Hello, Soum. It's great to see you. Welcome to Southside Stories.
Thanks, Pat. Thanks for having me.
It's our pleasure. Yeah, I'm really looking forward to this, not least because I know you've got some fascinating things to tell us around medtech devices, partly because of my own interest, because I used to work for a digital health company and not exactly what you do, but not dissimilar either. So I'm looking forward to this discussion. But maybe you could just start by telling us a little bit about your background, where you're based, and your job title.
The founder and CEO of MV.Health, also known as Mystery Vibe, we started 2014, so 11 years ago. My background is biomedical engineering. My degree was in biometrics, working in ophthalmology back in Bath in 2004, 21 years ago. The work I did back then was building cameras for security. So using biomedical, but the application was in defense. So cameras that look at eyes to recognize people. So that's the biometrics bit in places, say, like airport security. So we did that. That was my PhD and postdoc. Finished that 2008. Then moved to London, worked in Deloitte for 7 years in various consulting roles. And then in 2014 started MV with the goal of bringing the same engineering knowledge that we had before, but this time in the application in urology and gynecology.
Great. And perhaps we can bridge from that just to talking a little bit about MV and what your solution is. We'll talk about the technology in a bit, but just tell us a little bit, just in broad terms, what the solution does.
Yeah, so we use vibration of 50 to 100 hertz, which has a lot of clinical evidence of at least 50 years. There's a lot of evidence, so that's why we use vibration in various form factors and different shapes and sizes to precisely deliver vibration on points, mainly for pain management. So, for example, pelvic pain, period pain, mastitis, which is breast pain, uh, dyspareunia, which is painful sex, prostate pain. So a whole host of things in urogyn and other areas like arousal, dryness, erection, ejaculation. So, so quite a wide breadth of sexual health issues can be addressed by applying the right vibration frequencies at the right points.
How did you make the leap from sort of your PhD and some of the theoretical background and airport security and scanners and camera? How did you go from that to thinking about vibrations and how that might be useful for chronic pain?
So the application is kind of the same, like the work we did before, where we'd work with ophthalmologists and they would teach us everything we need to know about eyes, and they would kind of tell us what we need to build. And then when we decided that we want to get back to biomedical and look at a really significant health area which has a big patient population but not enough solutions, and even with a little bit of research we found urogyn to be the big space. And this is, I'm talking about 15 years ago when we were just thinking about it. And urogyn, whether it's prostate cancer, menopause, pain after childbirth, period pain, things that now we hear about a lot in the media, wasn't really talked about back then. So if you knew people going through the issues, or if you talk to a specialist, you would find out. So that made it quite obvious that if we were to do biomedical again, it had to be in an area which needed solutions rather than a very saturated market. And like, say, for example, ophthalmology, where a lot of stuff has been done, there isn't that much that we could add, which would be significant value. So that's how we got into this area. And the vibration piece came in very much driven by the doctors. Yeah, as we started engaging the experts, whether urologists or andrologists, gynecologists, they then directed us to the clinical evidence, the research that has been done there. And they said, if you want to solve this issue, this is a very good way to tackle it. can you go figure out how to build it? So it's very much, um, the doctors telling us what to do. Again, just like back in the ophthalmology. So the work we do is not really that different from the work we did 21 years ago. Um, it's just, different health area.
So there was already clinical evidence or clinical research into how vibrations can impact pain. That was already kind of understood, was it?
Yes, and all areas of sexual health. So arousal, vaginal dryness, erection, prostatitis, so all of these areas, there was already enough evidence saying that stimulation, uh, typically through vibration, would lead to blood flow, which would help, whether it's pain, arousal, erection, etc. So the fundamentals are really simple, which is no different from you having back pain and you having either a massage or a theragun, and that vibration or that movement using fingers helps with that blood flow and helps with that pain. So it's not really that different. It's different frequencies, different intensity, and the ability to be very precise.
Yeah, so I guess at that point then, you've already alluded to this, but it became a challenge, I guess, around the device. How do the form factor of the device, how is
Correct.
it used, where is it used? Can you describe a little bit about what that sort of journey looked like? How long did it take you to iterate to get to this point?
So I think it took at least 5 years from the day we started to having a product which was good, um, effective, and user friendly. So there's a lot of iterations. And because it was a first device, we were building all the infrastructure from scratch, setting up our R&D center, setting up the initial manufacturing plant, getting a lot of capital to do research, trials, etc. So the first 5 years was pretty much all R&D. And then we got our FDA in 2019. Then we started formal clinical trials. And now we have 16 papers, but it kind of happened over many, many years. So from 2019 to now 2025, uh, I would say the first paper probably came out 2 years after. It takes a while. And then you run a lot of studies in parallel. So, for 16 publications, we probably ran 30 studies because not all of them will work out. And some of them will give us feedback how to make the product better. Some of them will give us feedback on what different product we need to make. So they're all very valuable. But from a study to paper output, is typically like 2:1, the number of studies. So at any one point, we have at least 10 studies running, and maybe 5 of them will produce a significant outcome, which would then lead to a publication.
So backed up with a lot of evidence. We're going to talk about also Class 2 regulatory approval in a second. But before we get to that, just tell us a little bit about how I would access the product or the solution, how I would use it. For example, is it external or is it sometimes internal?
Yeah, so the best part about the classification that vibration sits under, it doesn't, it's OTC, which means it's over the counter. You don't need a prescription because there's no risk to patients getting hurt or side effects. And there's a lot of predicate devices, which means it has decades of devices which already exist, has been used medically, so the regulatory bodies know what the risks are. So that makes it really user friendly from a patient perspective. So, for example, let's say somebody has pelvic pain after childbirth, they might go to a doctor or a pelvic floor therapist, but they might not have time. They might not have the resources. They could simply, in this case, go online, order it, buy it, get it delivered, use it. So it's no different from buying an electric toothbrush, for example. It's a healthcare device. It is regulated, but you don't need a prescription. So that makes it really accessible. So that was a big piece. keeping it OTC.
Hmm.
In US, where most of our sales are, we are covered by FSA, HSA, which is a flexible savings account. It's like a medical payment plan. So it's partially reimbursed. It's basically the tax then and money that gets deducted. So that's quite nice. In US, they save around 35%. One of the long-term pieces of work we are doing, which we started 2.5 years ago, is creating full reimbursement codes because they don't exist in this space yet. So if we manage to create that, the big piece would be including the devices at source. So when the problem starts, so for example, pelvic pain could start after having a kid. So straight out of hospital, straight after childbirth, they have to get it in a kit which says this is a device they can use. This is the instructions on how to use it, how many times a week, how many weeks. And that would solve most of the chronic pain issues without relying on the new mom to have the time to go for therapy, which is really time consuming. So,
Yep.
so in terms of access from a patient perspective, uh, either the very simple route, they buy either, from a pharmacy, from a website, etc. That's one option. And, they don't need any prescription. They just buy it. If they're in US, it's partially reimbursed. And the second piece, which is not yet, but then we are working on, is they wouldn't even have to do anything. They would just get it straight away from the hospital. Or, say another device could be post-cancer recovery, prostate cancer. So it's that reaching the patients at the right point at source.
How aware are either the patients themselves or the physicians in that chain of either this type of device or your device in particular?
So devices is a very new area in this space. So a lot of the work we do, we're the only device in this space. An alternative would be a tablet, hormone replacement, lubes, etc., which are all very valuable and all complementary. So there is quite a bit of education we have to do explaining why a device is useful. And one of the easiest way to explain it is it's a one-time cost. So from a financial perspective, a device always works out cheaper. And then there are no side effects. It's a device. The worst thing that can happen is it's not going to work for you. But you will never have any side effects from using a device. So those are the two big reasons why we are complementary. So for say erectile dysfunction, they might be on Viagra, they might still have a device because they might not want to use Viagra every day. Of course, there might be side effects. And for many people, they can't have certain tablets. So Viagra, for example, cannot be used for people with heart conditions, which rules out at least 30% of patients, which means in that case, they might not have an option and they need the alternative. So it is quite a big education piece, which is why, the last 11 years, I would say the biggest work we've done is being out there, whether it's press, billboards, through doctors, hospitals, um, content, just
Yeah.
education probably takes up 50% of our time.
Yeah.
Whereas the other 50% is obviously the R&D and the research. But the research is very long term. So it's not intense. It might take 5 years to release a product. So we do it very carefully and very iteratively, very deep. Whereas education is something you have to do many, many times through many, many channels. So it's very intense, is getting the word out there.
You recently, I think, well, actually, a question for you. I mean, when did you get your class 2 approval? That
2019.
was recent, 2019.
Yeah.
Was
So
that,
it's actually quite
yeah,
straightforward in our case
okay.
because
Mm-hmm.
predicate devices exist, which is the biggest thing when it comes to approval, is when enough predicate devices exist, you can use that and the same code, as long as it's the same underlying principle, to then be able to register and follow the same requirements. So in the case of vibration for, it's called vibration for therapeutic use on genitals. That's the specific code. And it's existed for decades. So it was a relatively straightforward piece, us adding ourselves to that code. The bit that takes a very long time is the clinical trials and the journal publications and the evidence gathering. That, easily takes 5 years to have significant amount of data. So I would say in our case, the regulatory piece is, let's say 6 to 12 months of work, whereas the clinical evidence piece is 3 to 5 years of work.
And the regulatory approval side, how important was it getting that? Does it add to the overall credibility, reassurance for patients?
It's a fundamental requirement. So it's something you
Okay.
cannot get to clinical trials without even getting
Right.
FDA. I mean, the big difference is regulatory approval simply means it's safe to use, because they don't know how effective it is. And that's the second piece, is doing the clinical trials and publishing in peer-reviewed journal papers to prove that it's actually effective. So, for example, you remember when the Johnson & Johnson vaccine came out, it was FDA approved, but the efficacy was 50%.
Yeah.
So what that meant is if you took it, you would be still, assuming they did enough safety tests, it'd be fine, but it wouldn't help you in 1 and 2 cases. So that never took off. Whereas the Pfizer vaccine had 95% efficacy, and it also was FDA approved. And obviously that, was rolled out. So that's exactly the same, in any healthcare piece, whether it's medtech or pharma, is FDA simply says this is safe, and then the clinical evidence shows how effective it is, or if it is effective at all. Because you might have something which is very safe but doesn't do anything.
That's very well explained. Yeah, that's great. I'm clear on that. Let's switch now to sort of health systems and some of the areas that you operate in terms of geography. So you have a great perspective, I think, on both UK, US, and perhaps parts of Europe as well. Let's maybe just start with the UK for a minute. What's the experience been like for you working with the NHS or trying to get uptake for your solution in the NHS?
So I would say UK is one of the best hubs for research and development. And so we work with the head of urology at King's, and St. Thomas Hospital is one of the leaders in biomed. They have the London Institute of Healthcare Engineering, which is state of the art, custom built center in collaboration with people like Siemens, NVIDIA, Medtronic, etc. Like you get the best researchers, there's people, the talent, the professors, the doctors, and access to patients. So it is, and we can't imagine doing what we do anywhere else, and it's very cost effective. So I'm sure you could do the same thing, probably in Johns Hopkins or another big research-based hospital in US, but it would probably cost 10 times, what it would cost to do that here at King's or anywhere. So the quality is second to none, the medical research, both in the medicine and the engineering. The challenge is the healthcare setup, and this applies to UK and Europe, is very much government led. So what we do is we improve quality of life. You have pain. If we address your pain, you have better quality of life. But there's nothing really we do that saves lives. We do, one of our applications is prostate health, which might reduce the chance of cancer, but it's a very long-term thing. Like if you get prostate cancer, there's nothing our products can do. So from a purely budget perspective, it's really hard for a government to prioritize quality of life solutions over life-saving solutions, right? And that totally makes sense. If you have limited budget, you have to prioritize what's going to save lives. If you had unlimited budget, of course, you could do the other stuff. So the way to overcome that would be to make it significantly cheaper, so that it gets to the point where the business case is so overwhelmingly positive that the government can make an exception and accept a quality of life product. Say, for example, Ozempic. Yeah, because the business case is so significant on the cost savings in the long run that it's worth doing, even though they don't save lives, but it would need a huge amount of data to do that, right? Um, so that's what we are working on, in terms of the long-term plan is how do we get the cost down so low for NHS and other government healthcare that they can. And the only way to do that is to be incredibly high volume, because it's only when you have millions in production that you can get the cost down, not at thousands. So while that happens, which is a few years away, our focus is on private healthcare because and even within UK, we work with Harley Street, London Clinic, etc. So private healthcare is very straightforward. You go to a doctor, you pay for the visit, you get a device, you pay for the device. That's very clean, simple route to market. The advantage in US is it's almost all private healthcare. So that's the standard, which means you have, let's say, your prostate exam, you go to your urologist, you have it. The urologist says, please use this device once a week. I'll see you in a year. It's straightforward. Like you're not going to say no. Yeah. So that's why it's quite common in healthcare to be doing R&D in somewhere leading like UK, and then roll out in US, and then come back to UK with all the evidence from US to build the business case to eventually get it to the public through NHS.
Understand. Well, let's switch to the US then, because it sounds like that's where the volume in terms of your distribution is. Tell us, and it's a big market, lots of opportunity there. Tell us a little bit about how you've approached making inroads into the US medical environment. And a supplementary question is sort of for other entrepreneurs in this space or digital health who are looking to do the same thing. And for reasons I think you've already outlined, many UK companies do look to the US for expansion. What are some of the learnings that you've made that might be useful for others?
So how we got it out there, unfortunately, it's a very old school method of physically being present in every exhibition and conference. Because it's healthcare, it's a very face-to-face thing. Even though there is telehealth and stuff, if you want to work with a doctor or a hospital, you need to meet them. And even today, that's how it works. And the thing is, you need to build credibility, and credibility in healthcare is over time. Doctors are not that excited about something which is very new. They want it to be safe. They want there to be enough data, enough evidence, because their first concern is their patient safety above all else. The latest, greatest thing isn't necessarily the safest thing. So the only way, what we found to do that is physically being present in every urology, gynecology, pelvic therapy, menopause, prostate, like every main exhibition conference, being there, having your stand, having the devices, meeting the doctors, meeting them over and over again, getting them to try the devices with their patients, getting feedback, and being very genuine about it when there is feedback, actually taking it and making changes where it's valid. So that's how we build credibility. And again, it's like a 5-year process to get to a point where most of the doctors know you, they trust that you're doing this for true patient outcome. You care about feedback. Their patients give them good feedback. There's enough people using it. Then they start recommending it to other doctors. And that's the key is if you onboard a new hospital or a clinic or doctor, the first thing they'll do is they call somebody they know and ask them what they think. And that's always the case. They don't, look online or anything. They literally just pick up the phone and call somebody. And if you have enough doctors, clinicians, PTs, hospitals who already use the products, recommend the products, somebody will be able to say, oh, yeah, I know, I've used it, my patients love it. And that's all they want to hear. So, and that piece takes time, but it's almost, you really cannot get past the
Yeah.
evidence building stage
Right.
without that piece where
Yeah.
enough doctors recommend you within that circle. So the the short answer is physically being in every
Mm,
conference. Unfortunately, it's a very time consuming
mm,
long thing to do. So
mhm,
that's how we
mhm,
built our presence in US. Um, since 2020, just after COVID, we
mhm,
started. Like we
mhm.
started a little bit before COVID, and then there was a year off. But then 21, 22, 23, 24, now 25. Like we do at least 12 conferences a year in US, and maybe more. Some are massive, like 30,000 doctors come. Some are small, like 300 doctors come. But it's one of those things. You just have to do it.
It's quite resource. Is it resource intensive doing that? I mean, it sounds a
It's
huge
very
job.
time intensive.
Yeah.
You only need,
Yes.
I would say, two people, from the
Hmm.
company. Um,
Hmm.
and you could kind of distribute between each other as long as the people you know, know what you're talking about. So, but we easily spend a week a month, if not more, on conferences.
And do you have people based permanently out in the US, or do you
Correct.
tend to?
Yes. So you
You do,
definitely
yeah,
need somebody in
yeah,
US,
yeah.
ideally more than a few people in US. But in our case, we would go from UK and have US people, right? Um, because and also like the doctors we work with, they go because often the doctors want to go much deeper than what we know as engineers. We have a superficial understanding, whereas they might want a much deeper, delve much deeper into the cause and what can be the application. So then you bring some of the doctors who might be already attending, and that's where diversification is really useful. Is if you run studies with 30 different clinics, and there will be somebody that who's done a study, who knows the products, knows the patient, who can talk about it from a medical side. If doctors are busy, you can't always ask them to attend every conference. So yeah, I think the more widespread you are, the more credibility, the more data, the more people who trust that the devices are built for XYZ and it works. But yeah, it's very time consuming for sure. Resources, I would say, two people is probably sufficient per exhibition.
When you look ahead now, some to 2025 and beyond, what are your major challenges? What are your goals for the next 12 months or so?
I would say the biggest challenge is geographical expansion.
Mm,
So, for
mhm,
example, US is relatively straightforward in the sense that we do two things: direct to consumer and B2B. So B2B would be us selling to a distributor selling to a clinic, and that rolls out over time. And D2C scales over time. So it's relatively straightforward once you have built it and there's enough credibility and like you have good efficacy. So that piece is one unit, but the big challenge for a small company is saying yes to a lot of requests. So, for
mhm,
example, we have requests from Latin America, Middle East, Southeast Asia,
mm.
far off like Korea, Japan, etc. The challenge for us is if we say yes, let's say to Japan, we'd have to set up a subsidiary, we'd have to get a partner, we have to hire some people, you know, get the regulatory approval of that country, then roll it out, which is all doable, but not our skill set as a small company who is very research centric. We're very good at product, medical studies, doctors, etc. But if someone said, can you help set up Japanese distribution, we'd have no idea. That also means that we say no to everything just to focus on US and a bit in UK, which is not nice. Which means we built all these products. They have lots of evidence. They have lots of really effective, like 95% efficacy, and we want it to be in the hands of lots of patients. So the so for us, the way to solve it is to find the right corporate can take our products and distribute globally, which we are not really good at. And we can then focus on what we are good at: innovation, research, studies, um, working with governments, creating reimbursement codes, all of that stuff that we do and we want to do more of. And then finding the right home for us to be a subsidiary of so that they can scale distribution.
Who would be in your sort of medical device, I guess, or other category as a partner? Is it the Smith and Nephews and the Philips and Siemens of the world?
Yes, so
Are those the kind of
basically
players?
anyone who is in Urogyn. That's
Yeah.
really it.
Mm-hmm.
So it
Mm-hmm.
doesn't have to be a device company or a pharma or a consumer health specifically. It's if
Mm-hmm.
they currently have products already in women's health, men's health, urology, gynecology, one of them, then they are reaching the right customers already. And then they would simply be plugging in a portfolio of products to get to those patients' customers. And that's the easiest way to think of it. And they could be a pharma company who supply Viagra or Vyleesi or Cialis or something because they're already supplying to Urogyn. Then there could be a med device company who makes hardware for pain. They could be a distributor who distributes everything, uh, including Urogyn. So it's quite a wide variety of people as long as they have the channel. It's the channel fit that matters.
Yeah. And while the business is sort of maturing and you're going great guns on or expanding in the US and the UK and to some degree the UK, while all of that is happening, and then you're becoming perhaps more attractive for a future partner. And in the meantime, how do you fund the business? Do you need funding? How are you funded right now? Are you funding from revenue streams? What does that sort of look like?
Yeah, so we did our Series A back in 2021, and we raised 7 million. And that was that was the last time we did a round. And now we no longer need to raise money. So we can grow organically, but if we raise capital, we could grow faster. So it is one of the things we would have to decide probably next year is, do we do a Series B? Because it will be 5 years, yep, since Series A, um, just purely to scale, or we find the right corporate to be a subsidiary of, and then they can invest to scale. So it's something we still need to figure out. Um, but both would be good options. But we would need to decide on one or the other. Do we raise a big capital to scale a bit more, or do we become a subsidiary of a big group who can do the scaling without us having to raise money?
Supposing you go down the funding route for a little longer, tell me a little bit about team resourcing, hiring. Let's assume that you would, one way or another, be able to make some funding choices for next year. What's your ambition? What would you need what would you like to perhaps scale the team to, and what sort of roles would that require?
So interestingly, currently we only have 16 people, one sick, and we cover every area we want to do ourselves in-house. So there's nothing we outsource that we would do, for a long time. So for example, we outsource, like IP, legal, accounting, manufacturing, etc. But we don't really expect to bring, like hire IP lawyers in-house, etc. So we're very happy with the pieces we outsource and everything else we do in-house. I think the big piece in terms of scaling D2C is marketing capital. Yeah. Because let's say we spend $1 to make $2. And if we want to deliver, instead of 10 million, 20 million, 30 million, we would simply spend more, right? So that's the big piece that's where you need capital to scale fast, where you need to invest in inventory and marketing upfront and then make the money after. So that's a big piece of fundraising. And the second piece, which is the B2B and the global expansion, that's where we would need to hire more. So because B2B doesn't particularly need massive marketing spend, yeah, maybe a little bit of red press, etc., and a bit of brand awareness. But the big pieces there is, if doing a new country, setting up a subsidiary, all of the admin around it, getting the right partner, doing the regulatory approval, and then you probably need at least a person dedicated for each region from our side, who would then work with the distribution partners on the other side. So I think from a resourcing perspective, probably that would be where we expand, is on the B2B sales side. And whereas on the D2C side is much more on the marketing spend rather than resourcing.
On the geo expansion, what region would you look at next? The Middle East seems to be quite a big area for
So
investment.
we are actually
Yeah.
already
Mhm,
looking at
mhm,
Middle East, because
mhm.
it's quite straightforward to get regulatory approval with FDA, and then a bit on top to get their regulatory approval. And then because everything is private, it's again quite a simple system. So, and it's small countries in terms of population, so it's much easier to roll out. So if we do a geography outside US this year, we would do very likely Middle East. And then LATAM is also very interesting, because they're very keen to bring innovation from US. Again, it's mainly private healthcare. They're very happy to pay, say, $300, which is the average cost of a device. So quite a lot of the criteria works. And I think, for example, Brazil needs 40 days to get regulatory approval if you have FDA. So it's quite straightforward in our category.
That's great, Som. So good luck with that as you look either for a partner or decide to go down a Series B route. Let's just to move to wrapping up now, and it's a question I ask everybody, but who is a leader that's been influential on your professional life? And that could be anybody from somebody you perhaps worked with back early in their career, or an academic when you were doing your PhD, or a mentor, perhaps or a family member, even as you started to become this interesting mix of great background, the PhD, and then the track record in building your own business and being an entrepreneur. Who's been a great source of inspiration and help to you?
Too many people. Before I get to, like, I have one which I would say has inspired me the most is Phil Knight, the founder of Nike,
Uh-huh.
and his book Shoe Dog.
Uh-huh.
And the main thing I got out of it was perseverance, because the book is really about perseverance. It's above everything else. Like, I remember I think the first 10 years, at the end of every year they were bankrupt, and then they'd go and ask for money, and everybody's, what kind of business is this? Like, no one understood that rapid growth costs money. This is pre-VC days, right? And then eventually he had to go to Japan to get bank loans, because his banks wouldn't give him money anymore. And and I love that, because he talks about what it took to build a long-term business, and it's always a very long process, and it's always hard in the beginning. So I think that's helped me the most, having that perception of nothing good happens quick, especially in healthcare. Nothing good happens quick anyway. So, I would say that has been the most helpful piece that I read and I got inspired by and followed. But in terms of people, there's so many. So we have a big angel pool of investors, and they're incredibly helpful, and all of them are experts at their areas. They could be doctors, they could be M&A bankers, they could be corporate consultants, etc. And they're very generous with their time, and I can call them anytime and ask for help. And everyone is so good at what they do, and they can distill their knowledge to apply to what we do. So that's probably one of the reasons why we are still 16 people because we have access to so many amazing, talented people who I can call and ask for help and connections. So I think that has been the biggest value because, often you hear startups talk about how getting the right investors help them in areas they wouldn't even know about because there's only maybe 10 things that a bunch of startup you know, team are good at, but there will be 20 other things that they need to figure out. So my angel pool has been incredibly helpful.
So that's great. Two very good examples there. It's a lot of business people say to me, perseverance, sticking with it, tenacity is so important because there is so much to do. It is tough. It's very tough, as you say, in the early stages, and you need a lot of resilience to sort of keep going and reminding yourself of the North Star, the purpose and the vision of why you started the business in the first place. And you've clearly got that in spades. I mean, what better purpose to have than thinking about and solving human pain? That's a great purpose to have. Soum, thank you so much for your time. We wish you every success as you continue to expand the business in 2025 and beyond this year. Thank you so much.
So I thank you for having me again.